Okay, yes, I'm here again. I bring to you the knowledge you should know. Yes. So I don't know how many of you have heard about cataracts. I don't know how many of you have heard about cataracts. So if you have not heard, I'm going to use this opportunity to let you know what cataract is all about. So cataract is the clouding of the lens in the eye. Cloud, when I say clouding of the lens in the eyes. So that clouding, it's like you looking at a foggy window. It will be like if you're looking through the window, it will look like a fog. Now, some people have cataracts. Some know, some that don't know. Some that have known might meet someone who is opportune to have who is privileged enough to sight one physically and say, oh, it seems your eyes have cataracts. Oh, maybe this is the first time this person is hearing something like cataracts because someone somewhere have mentioned to him or her that there's cataracts in your eyes. Now, what are the factors that actually make people to develop cataracts? Some of the factor is age. Cataract comes with age. Cataract comes with some diseases like diabetics, people who are diabetic. And I'm telling you now that some of you don't know whether you are diabetic or not. I'm telling you with full knowledge of what I know that some don't know. You might be speaking with someone now, and there are some factors that you are noticing that may tell you that this person is actually a diabetic patient. I ask this person, are you diabetic? The person will say no. So yeah, I think they took light. So now, when I'm talking about what can make someone to develop cataracts, so I mentioned aging, I'm making diseases, and I was talking about diabetes. So I just needed to mention that some people don't know their status of whether they are diabetic or not. So now another one is what we call steroid drugs. There are some people that take drugs, they don't actually know the class of drug they take. There are some drugs I noticed that men usually abuse, steroids. These are the things that can cause cataracts. And another one, UV radiation. We try as much as possible to tell people who are actually people who use screen where these UV rays come out from to use a protective. If you see the lenses I'm wearing, it's a blue cut. These blue cut lenses, it protects against UV light. Too much exposure to UV radiation makes someone to develop cataracts. And not because as you are exposing yourself to sensitivity of the light, and over the time you see someone can actually develop cataract. And some people from trauma or injury, trauma or injury. Now, some people don't know what lens is all about. When I talk about the clouding of the lens, which is a cataract that make you see something to look foggy, as if you are looking at a foggy window and all that. Yes, lens is that clear part of the eye that help focus light on the retina. That's lens. It helps focus light on the retina. And we have different type of cataracts. We have nuclear cataracts. What are those nuclear cataracts? That cataract you just see at the center of the eye. You see the person develop one kind of whitish stain at the center of the eye. We have cortical cataracts. That cortical cataract is edges of the lens. You see that your lens, the clear part of the eye, the edges of it. Then we have the one we call posterior subscapular cataract. That's another one. We call it posterior subcapsular cataracts. Those posterior, we often see that is the back of the lens. It's the back of the lens, those cataracts to happen. So at this point, someone might be asking, does this cataract have symptoms? Yes, actually, cataracts have symptoms. To some people, cataracts can come out as a blurry vision. Your vision is no longer clear as it used to be. You start noticing that. Some double vision, then some sensitivity to light. They become so sensitive when light touch them, and you just feel like, and you see the color you as normally knows, that color is not like as sharp as it seems to be. So you start having color being faded in your eyes. And some people who drive, they will have difficulty driving at night. Yes, they have difficulty driving at night. Now, there are ways to know actually if you have cataract. There are ways to diagnose cataracts. Initially, I was telling you, in one of my videos, I was telling you the importance of seeing an eye doctor when you have a problem. And I mentioned that it's important to see an ophthalmologist, which is an eye doctor. So when you come to see an ophthalmologist, they will actually allow you to undergo some tests. One of the tests you are going to undergo is visual acuity. This visual acuity, they will know the extent, as they will know how far is your vision. They might ask you to read, close one eye, maybe ask you to close left eye, read with right eye. After that, you close right eye, read with the left eye. In that visual acuity test, they will actually know which of the eye is more affected. Some people, their right eye is more affected than their left eye. Some people, their left eye is more affected. Aside visual acuity, you can also diagnose cataract through slit lamp examination. Doctor will look at you through their slit lamp, the examination, and once through slit lamp, doctor will be able to say, oh, I look at the eye and say this person have cataracts. Yes. Then when I say retina also, yes, retina exam, you can actually through retina exam find out that someone have cataracts. Now ask me, what is the best solution for cataracts? Some people might want to use glasses, but that's not the best option. There's something we call cataract extraction. We call it SICS plus PCIOL. What's SICS plus PCIOL? It is sectionless intraocular lens extraction. In addition to implanting what? Intraocular lens, artificial intraocular lens at the posterior chambers of the eye. Now, during that extraction, some people go through ways. Some people can use manual, some people can use phacoemulsification, the most modern one, or they call it laser assisted cataract or phacoemulsification, to extract the lens. What happens through that extraction? During that extraction, doctor is able to have a cut through your posterior chamber, enter the eye, remove the foggy lens, remove the cloudy lens which is there, and should be able to do what? Replace an artificial lens in your eyes that have the same power. Before that, you can be, people who normally do this cataract extraction, they do a test called biometry. That biometry will be able to detect your intraocular lens power, so that doctor insert exactly the power of your eye so that they will be compatible. That's all. After this surgery, you regain your sight fully once again. There is no double vision, there is no blurry vision, there is no fading of colors once again. None of that will happen because doctor have successfully replaced your foggy lens, cloudy lens with one that you can see more with. That's it. Don't go to people who tell you there's where they used to remove cataract, all this traditional way, or in fact, some people have gone through the wrong area, and at the end of the day, there is no even capacity again to even successfully put the main thing, the lens you put there, because they have applied all manner of, like, going through the crude method. Do you understand? So I'm giving you this knowledge. I hope it has stuck in your head. This knowledge, as you hear it, pass it